Normalise the birth process. The impact of hypnobirthing and doula care on obstetric anesthesia. We are going to talk about the normal birth process and why it is important. My first steps into alternative birthing and the system errors I have identified in my practice, what we can do differently, and how this is all supported with background physiology, and finally how this can tie together with Chinese medicine. This was me and Ina May Guskin back in Manchester in 2016. Ina May Guskin was regarded the mother of the normal birth process in the US. This picture shows her bus caravan back in the US. She and her team helped thousands of women to give birth in her buses back in the US. This was me invited to a birth psychology congress in the US. That was my brief biography. And my first alternative medicine company in the UK. I held several presentations across the country, popularizing the normal birth process and educating the public. My presentation for midwife students at the University of West of England can be seen in this picture. This is my midwife friend who inspired me in this journey, and she supported her own daughter to give birth to her grandson in her own living room at home. This was my article published in the Doula UK, where I summarized my experience and my recommendations. So what did I summarize and what system errors I have identified? This is all important because patient experience matters. I have seen lack of information on the mother side. This can be helped with evidence-based birth.com, for example, to demystify the birth industry. I have seen unnecessary inductions, immobilisation with epidurals and cascade of interventions, and very often late interventions which led to poor fetal or maternal outcomes. I have seen lack of continuity of care, where somebody started the birth process and then they were taken over by someone else and nobody knew what was going on. I have seen undereducated professionals about the normal birth process, so they had no idea how to support the normal birth process and how to keep it normal. They obviously and brilliantly defended themselves, but the patient experience was really poor. I have seen desperate legal defenses, which I believe would have been avoidable. So what are the roles and opportunities I think that may emerge? We can optimize the physiology first. Before doing anything else, we need to study and optimize the normal maternal physiology first. Informed decisions and shared responsibilities with the mother. Because if we take all the responsibilities, we need to obviously be very vigilant, and the mother may feel left out of the situation. At the end of the day, it is the mother who needs to decide and who needs to live with the consequences. Most likely, changes will be initiated by the service user, which is the mother. Otherwise, on the professional side, politics may always intervene, and the stronger dog will take the prey, so nothing will change. Don't pretend to understand the birth process. We often don't understand the birth process. We don't respect the birth process, which means that we need to change our paradigm. instead of just inducing it, what if the baby doesn't want to engage in the induction, and which may lead to C-section inevitably? A good birth, I believe, starts somewhere outside the hospital. We need to familiarize with family dynamics. We need to predict certain outcomes, and we may use ancient medical schools and disciplines such as Chinese medicine. We will see how it goes. This is the medical background. Support and prioritize the normal birth process. My midwife teacher called it intelligent tea drinking. Darkness and melatonin production, privacy, relaxation and minimal brain activity, breathing techniques to induce relaxation, vasovagal reflexes. We can change positions and use gravity. We can prevent the fear, tension and pain syndrome, which means that if the mother feels fear, they clench their muscles and push against this tension, and this inevitably generates pain. The calm and connection system, which is the parasympathetic nervous system, may be utilized to our benefits, and we need to respect the Ferguson reflex. The Ferguson reflex is, as we know very well, the connection between the vagina, the cervix and the uterus, which means that the more the uterus contracts, the more the cervix dilates and the vagina lets the baby through. If we intervene and interrupt this process with an epidural catheter and some sort of paresthesia, we can hinder the birth process extensively. This is the little birth center in Bristol. They don't use induction. This is a midwifery-led birth center, and they can utilize the normal birth process efficiently. So what I do differently? There are several birthing techniques I use. First of all, preparation. I believe in the Albany midwifery model. So there are two midwives engaging with the mother during pregnancy, and they get to know each other. So when labor starts, they can work and they can trust each other, and they can work effectively. Oxytocin, trust, bonding, and oxytocin is our friend. So we can see that why doulas may be beneficial for our maternity system, for continuity of care and careful early stage management. Breathing techniques inducing vagal tone, changing positions, facilitating the fetal movement. The baby is said to be active and actively involved in this process, so they just shuffle through the birth canal. Acupressure and acupuncture may help. This brings me to the concept of qi and its movement, bioelectricity movement in the fascia. I'm going to refer to Claudia Zitkowicz, a brilliant birth professional in the US. Emotional support is also important, which facilitates oxytocin release because it relies upon trust and bonding, and obviously love. Birth is rather a psychophysiological field in which oxytocin is released and love is our friend. So this is the medical background, the biochemical background. Oxytocin, the love hormone. You can see several great thinkers and their publications. And oxytocin can induce analgesia, pain relief, amnesia, and it can prevent the painful obstruction syndrome, which is which is tied together with the fear, tension, pain syndrome we talked about recently. So again, privacy, darkness, intimacy, trust and relaxation may all help. We can see how animals give birth. They never stop. They do it usually in the darkness, and they move all the time. They relax and they let the baby through. These are all the books I have read. I can recommend it to everyone. This little conversation is about conscious babies, birth psychology, and how we can feel empathy with these little conscious beings as they are coming through the birth canal. And if we believe in reincarnation or spiritism or the soul, they can all be brought in here, because in opposition to the previous beliefs, materialistic beliefs, these little babies have consciousness and they feel, and they are very sensitive during the birth process, which is inevitably painful. But if we make it even more tense and more painful, that may lead to poor maternal and fetal outcomes and experience. So how can we make it less painful and a more pleasant and comfortable experience? We can use doulas. Why are they good for the system? We can see the continuity of care, the Albany model. Two midwives building trust and rapport, and they bond with each other, with the mother, and they can support each other effectively during the birth process. These doulas can do client representation because they are paid directly by the client. They can lead to cheaper care from less interventions, because the more interventions, more operations we do, the more expensive our care will become. We can facilitate shared responsibility with the mother, which brings us to the Montgomery case medical legal lawsuit. We can use less public funds from the system. We can better distribute staff workload and optimize the day and how midwives are utilized during the birth process. We can call the midwives only when the doula cannot cope with the situation. Importantly, we need to emphasize that this is now the internet generation. So good news as well as bad news spread online like a bushfire. So I think it is better to talk about things, and hopefully good news will spread more easily and better, and we can optimize our care and make a good reputation for ourselves. This publication is from Claudia Sitkowitz, who is a brilliant birth professional from the US, and she talked about 4 types of births which are classified according to Chinese medical principles. They can be used to early predict problems and complications during pregnancy and labor. So we have time to prepare and tailor our care to prevent any deterioration. First of all, Qi deficient birth. This is basically a mitochondrial weakness and or dysfunction, and just like in any other cases, menses history will be important, because if the mitochondria are weak, their generated electromagnetic field will also become weak, and they can't produce energy to feed, for example, muscle function. Therefore, muscle weakness will appear. For example, these mothers cannot do squats and they will have rectus diastasis. And here we can talk about the 5 functions of the chi, such as warming, lifting, defending, holding, transporting, and transforming. So we can go through these functions step by step. We can see the warming function in cold extremities. They usually feel cold and they have cold hands and feet. The lifting function comes in with sagging tissues and poor tissue tone, flesh tone. The transporting and transforming function comes in with digestive weakness, which leads to diarrhea. We can see the defending function with immune deficiency, which is again about mitochondrial weakness, and the immunological Warburg shift. We can see the early mitochondrial function and the subsequent waste production due to low energy metabolism, and the waste production usually brings in a sterile inflammation and swelling. Everything swells up, including the tongue and the ligaments, and the brain as well, including limbic system swelling and depression. And this ties together with the holding function of the chi, because if ligaments swell up, they get longer in length, and various conditions such as uterine prolapse and varicose veins and hemorrhoids may develop. The menses in this case, in this condition, becomes pale and scanty and watery because of the increased capillary permeability, and they usually have cervix incompetence because the holding function of the chi becomes weak, and they also have weak contractions. The good point here is that we can use gravity to wriggle the baby through the birth canal, so there will be some possible interventions to optimize the maternal and fetal outcome and experience. We can talk about it later. This is a little diagram about how we get exhausted on the left hand side with strong mitochondria and in healthy state, and on the right hand side with weak mitochondria in a disease state, when there will be a lot of waste produced and a subsequent cleaning mechanism and inflammatory process comes in, which then generates histamine and swelling, and all what alternative medicine does is nothing else but cause this inflammation, repair mitochondria, and digest the waste. We can see the young deficient birth subtype on this slide, which is very similar to chi deficient birth. The patient feels cold despite the fact that pregnancy and birth are both inflammatory processes, so the mother usually feels hot. If they feel cold, they want another blanket. It means that they are usually young deficient. They usually have diarrhea due to poor digestive capacity, and they have poor peripheral circulation, they have poor digestion and ankle swelling. They have long menstrual cycles and cramps because of the cold inside. They usually have hypothyroidism or adrenal fatigue, Addison's disease, and they usually pass their due date because the internal cold fails to generate and trigger the birth process. If they go into birth normally, they usually fail to progress, and they become weak and irregular in contractions. Poor fetal positioning and inadequate contractions may come. Here are the yin deficient births and perhaps the chi stagnation. The yin deficient births are very tense, they are fearful, they are anxious, they don't want to lose control, and they tell everybody what to do. They are restless, they are irritable, they are unable to settle down in the evening, and they are impatient, and they don't accept care either. They usually have an extreme necessity, or they have an extreme sense of exercise. They don't want to rest. They usually feel anxiety because of the background neuroinflammation. Inflammation is everywhere in these patients, which implies dryness, because this inflammation dries up all the bodily fluids and the tissues. Dryness is in the skin, eyes, lips, throat, mucous membranes. They have not much oligohydramnios, so they will have low amniotic fluid volumes. They have constipation, they have diurine and dry vagina as well. So inflammation and soft tissue inflammation is everywhere. Autoimmunity, victimization, self-victimization, and they are always vigilant and watching out for any possible threats, and they defend themselves all the time. They have carpal tunnels and plantar fasciitis as part of the soft tissue inflammation and disintegrating water in their fascia. They are usually slow to progress because the cervical dilation is poor and slow, and they don't want to give up this control and just let nature do whatever she wants. Usually in a good way, but they don't want to accept it simply. They have preeclampsia and hyperemesis, preeclampsia from a weakened magnetic field in the blood, and this is called liver young rising in Chinese medicine. We can talk about later in a separate presentation. And they are usually insufficient to weight gain because of the edema, lack of edema in their body, which is normal. Edema is usually normal during pregnancy, but they cannot put enough edema on. This is pathological. This IUGR means intrauterine growth retardation, which means that their babies are usually on the lower side of the percentile. So they are usually small in size. It has its own advantages, obviously, but this is also a sign of yin deficiency. They have oligohydramnios, which means that they are low in amniotic fluid, and they usually have preterm contractions because they are unable to settle down and relax. Morning sickness, heartburn, constipation, asthma, and poor sleep all are liver chi pathologies invading various organs, and they usually have excessive sensitivity to oxytocin and epidurals. They drop their blood pressure quickly and massively, and they have poor outcomes after misoprostol treatment as well. Blood deficient birth is very similar to yin deficiency, because yin is blood and estrogen is in the background, which is in the blood, and this is why the Chinese call it blood deficient births. So they usually lack estrogen. Not only estrogen, but this is part of a package. They usually have insomnia, anxiety, depression, muscle cramps, and numbness and tingling in their fingers due to poor peripheral circulation. They have very painful contractions and slow dilation, similar to the yin deficient, and they are usually slow, or they fail to progress. They have insufficient lactation because milk production usually depends on blood, They usually have postpartum depression and constipation, dryness everywhere again. And obviously, again, there are certain signs in their menses and their previous gynecological past medical history, which we can take into consideration and predict potential problems which may come during pregnancy and labor. They have dry skin from lack of estrogen, brittle nail and brittle hair. They are all signs of low estrogen levels in Chinese medicine. The last one is qi stagnation birth. They are the most popular and most common presentations because they are stressed, needs control, and birth is all about loss of control. They have tight muscles and ligaments and premenstrual syndrome, mood swings, irregular menses, and depression. I don't want to go through this, but they are these types of personalities with interpersonal dramas, projecting anger from unprocessed emotional traumas, and they have muscle clench, initiating the fear, tension, pain syndrome, and going into a cascade of interventions. They need to be moved with exercise from inside their body and outside as well. And this is the way how to support them, very briefly. So final thoughts. Doulas have several benefits and beneficial impacts on the system. We can see several internet resources about the demystification of the birth industry, and this is all about informed consent and giving information to the mother. Chinese medicine may be able to identify these maternal and fetal pathologies early, and we can predict certain problems during pregnancy and labor. Simple supportive techniques may help to optimize maternal and fetal outcomes and may lead to a better birth experience and patient experience because it matters. Patient experience matters. Avoid induction and immobilisation, which may lead to a cascade of interventions. So there may be something better than epidural out there. Because epidurals may do more harm than good. If they need to be used, early, well-considered Caesarean section may be beneficial if supportive techniques don't help. Another possible change is when they pass their due date. In case of young deficiency, we can monitor the mother, and if any doubt, we can plan a Caesarean section early. So what I learned from clinical work: respect the birth process. I'm not almighty. Less interventions, less complications, cheaper care. Include complications in the birth plan. It is the mother who can change the system. Teamwork, the father and the mother, the doula and the staff. A little bit of this and a little bit of that. Get the right composition for every mother. I'm talking about interventions and optimization first. A new medical era may be coming, where doctors and midwives may have advisory roles only, individualized decisions in a standardized medical system, shared responsibility between healthcare provider and the service user, and we can optimize again bodily mechanisms first before medical interventions. And the internet generation may self-educate themselves, and they have special demands. Doulas with heads of alternative medicine, and we can cut budgets with less interventions and less litigation costs. Individualized decisions in a standardized medical system, as I just recently mentioned. Here in the UK, we also have an increasing demand for home births, and this way we can optimize labor ward workloads, and we can better serve and the public. Thank you for your attention.